mitochondrial donation, it's also called mitochondrial replacement therapy, can be the solution for females who only have faulty mitochondria, and also for carriers with high amounts of faulty mitochondria. The chances of producing embryos with low enough amounts are generally low. The faulty mitochondria of the mutant carrier are basically replaced by healthy mitochondria of a donor female. So the nuclear DNA is removed from both egg cells, and the nuclear DNA from the carrier female is then implanted in the donor's egg cell with the healthy mitochondria. This way, the child will have the mitochondrial DNA from the donor, but the nuclear DNA from the carrier female herself. And with this process, a small amount of the carrier female's mitochondria, which could obviously be faulty ones, may still come along. And it's, of course, an important question whether this small amount could get higher in the child, and it seems to be possible. It's not reported yet in the literature in children born, but there are some data coming. And if so, it's also important to know how high will it get. And instead of performing the transplantation in the egg cells before fertilization, this can also be done after fertilization. But other than that, the principle is the same. So Professor Mary Herbert's team in Newcastle, the UK, are pioneers in this field and are performing mitochondrial donation in a clinical study setting in cases where there is a risk of transmitting serious mitochondrial disease, and also that other options like PGT are not suitable. So since they received their license in 2018, over 30 cases have been approved. And from what I know, about a third or so have been treated, and a few babies have been born, but that has not been published yet. So we are eagerly awaiting the publications of their first experiences. And Mary Herbert has actually moved to Australia to be part of the introduction of mitochondrial donation here, which is great. And for example, to train embryologists to carry out the procedure in the laboratory. So here in Australia, similar to the UK, the legislation had to be changed to allow mitochondrial donation, and May's law, named after a 5-year-old girl with Leigh syndrome, was introduced in 2021. And subsequently, it was passed by the Australian government last year. And as a result, the mitochondrial donation will be introduced here, as we all know, through the MitoHope program. In short, it is for individuals who are at increased risk of having a child severely affected by mito, for whom other reproductive techniques, so the testing in embryos or testing in a pregnancy, are unsuitable to reduce this risk. And the female's own health status and how a pregnancy may impact their mito symptoms is another consideration.